All right, today we're going to talk about something that's, well, a hidden danger for millions of people. How some really common medications, things for like high blood pressure, can silently put your lungs at risk, especially if you have asthma.
So, can your heart medication actually trigger an asthma attack? I mean, it sounds kind of crazy, right? But it's a very, very real question. You're taking a pill for your heart, and all of a sudden your breathing gets worse. Why is that? Well, we're about to break down exactly how that can happen.
This is one of those classic dilemmas in medicine. You've got one health issue that needs treatment, but the medication for it could actually make another condition, like your asthma or COPD, a whole lot worse. It's this tricky situation where the treatments themselves kind of start to fight each other.
Okay, but let's start with some good news first. There's a class of drugs called alpha blockers, and for the most part, they get a big green light when it comes to respiratory safety. Let's dig into why.
So, how do these alpha blockers actually work? Well, they target these tiny things called alpha-1 receptors, and by blocking them, they cause your blood vessels to relax and widen. That's great for high blood pressure. But the million-dollar question is, what are they doing to your lungs?
And this, right here, is the key to why they're so safe. Alpha blockers have almost no direct effect on the muscles in your airways. They just don't cause that tightening or constriction that's the hallmark of an asthma attack. So the main takeaway here is pretty simple, right? If you've got asthma or COPD and you need a medication for something like high blood pressure, alpha blockers are usually considered a really safe and effective choice that isn't going to mess with your breathing. Okay, one category down, two to go.
All right, next up, beta blockers. Now this is where things start to get a little tricky, because with this class of drugs, the specific type you take is absolutely critical.
And I really want you to remember this. Not all beta blockers are created equal. This isn't a one-size-fits-all situation at all. The differences between them can literally mean the difference between a safe treatment and a serious breathing emergency.
Okay, so you've got two main types you need to know about, non-selective and cardioselective. And honestly, the names themselves give you a huge clue about what they do. One is really broad, it's non-selective, while the other is much more targeted or selective for the heart.
This table really breaks it all down for us. See, your body has two key beta receptors, beta 1, which are mostly in the heart, and beta 2, which are mostly in the lungs. Now, the non-selective beta blockers, like propranolol, they block both, and that's why they get a big flashing red light. Blocking those beta 2 receptors is really bad news for your lungs. The cardioselective drugs, like metoprolol, mostly stick to the heart's beta 1 receptors, which makes them way safer, but they still get a cautious yellow light.
And this quote right here, it just nails the problem perfectly. When you block those beta 2 receptors in the lungs, you can get something called bronchoconstriction. That's just a fancy word for the tightening of your airways. And for anyone with asthma, well, that can trigger a full-blown attack.
Okay, so what's the deal with that yellow light for the cardioselective ones? Are they safe or not? Well, while they're much, much safer, they're not totally risk-free, especially if you're on a higher dose. So the bottom line is, even with this safer option, you've got to be cautious, talk it over with your doctor, and keep a really close eye on your breathing.
So, we've talked about blockers, right? But believe it or not, the risks don't stop there. Let's talk about our third category, Pilocarpine. This one is, well, it's a real curveball because it works in a totally different way.
So, unlike the drugs we just talked about, this one isn't a blocker. It's actually the opposite. It's an agonist. Think of it like this. Instead of putting the brakes on, it's hitting the gas on your body's rest and digest system. And while that might sound relaxing, it can have some pretty serious side effects for your airways.
So, here's the problem in a nutshell. Pilocarpine does two things you really don't want if you have asthma. It ramps up mucus production in your lungs, and it causes the muscles around your airways to contract. More mucus and tighter airways, that's basically the recipe for a severe asthma attack. This definitely puts it in our red light category.
Yeah, so the medical advice on this one is crystal clear. Because of these effects, pilocarpine is a drug you should pretty much always avoid if you have any kind of reactive airway disease. It's really only considered when the potential benefits are so massive that they clearly outweigh these very serious respiratory risks.
Okay, whew. So, after all that, you're probably wondering, what can I actually do about this? Well, let's pull it all together into a simple, practical safety guide to help you have these conversations with your doctor.
Think of this as your personal 4-step safety check. It's super straightforward. First, always know the class of drug you're being prescribed. Second,
If it's a beta blocker, you've got to dig a little deeper. Is it the risky non-selective kind or the safer cardioselective kind? Third, and this is huge, you have to be your own best advocate by monitoring your own symptoms. If you start a new med and notice your breathing is worse, that is a major red flag. And finally, and this is the most important one, always talk about this stuff with your doctor. This is all about being an informed partner in your own healthcare, not about making these big decisions on your own.
So, we've just peeled back the layers on how a few common drugs can interact with your respiratory health. And it really makes you think, doesn't it? It leaves us with one last, really important question. What other hidden conflicts might be lurking between the medications you take? You know, just being curious and asking the right questions, that's always the first step to staying safe and healthy.